Hey everyone, it's Denise Brown from the Caregiving Years Training Academy. So I've had an idea that I have been pursuing for a period of time, and I was feeling like this is an impossible dream this morning. And I thought, well, what will help you keep going? And I thought, well, I should talk about it and be accountable about it so that I keep doing things. So that's why I'm recording this for you. And here's what I'm working on. Actually, I'll tell you, here's why I'm working on this. In the summer of 2023, Medicare announced two new billing codes for services to support older adults and their family caregivers. They are called Community Health Integration and Principal Illness Navigation Services. These services are actually provided by auxiliary professionals like caregiving coaches, the individuals that I train. This is the first time auxiliary professionals will be reimbursed for providing services through Medicare. It was like a wow day when I saw that. And I have been following this, researching this, talking about it, asking about it ever since. It's an obsession of mine. And then 2 months after I saw that, 2 months after I started learning about these new billing codes, I went to a conference in Vegas called Health, and it's spelled HLTH. And at the 2023 conference, they had this big pavilion in the middle of the conference exhibit floor for patients. They did it though, so that startups and executives and anyone in the healthcare space could take some time to actually get feedback from patients about an idea or to hear about a patient's experience to understand a problem. Now, I loved this. I actually did something similar when I used to host the National Caregiving Conference. Our attendees would also actually attend focus groups that we organized. And an organization that wanted to serve family caregivers, launch a new product or a service, would host a focus group and then provide an honorarium or a gift card to attendees of these focus groups. So I always thought it was so nice to be able to offer attendees an opportunity to make a little bit of money while they were at the conference. So I did focus groups, and this particular organization set up a pavilion, and patients shared their stories. It was a very interactive exhibit, and it was big, right in the middle of the exhibit floor. So I thought, well, this is great that they're doing this for patients, but what about family caregivers? Family caregivers manage, advocate, and navigate within 17 caregiving systems. If anybody has an insight into how messed up the systems are, it's family caregivers. And family caregivers are the only system that connects all the systems. We're the 18th system connecting all the 17 systems. So if you want an insight into what the experience is like within the systems, family caregivers are the ones that know. They have the insights. So I thought, well, why isn't there a family caregiving pavilion? So I sat in a session that was sharing something unrelated, but it was the session where I had the insight. I thought, because people don't get family caregivers are patients. Oftentimes the systems only see family caregivers in service of their caree. And I want to let you know it's not just healthcare systems, it's also large caregiving organizations. They only see the family caregiver in service of a caree. It is why the initiatives that they start and the programs that they launch sometimes miss the mark because they don't get it. It's so frustrating to me, and I'm not sure why people don't get it, but they don't get it. For instance, the help that my dad needed wasn't the help I needed. Like, hello. And the help my mom needed wasn't the help I needed. We are different people. I didn't exist just to be in service of my parents. I have my own life that I wanted to keep. I don't know why people don't see that. I don't get it. Anyway, it's one of my greatest frustrations. And I had an insight yesterday about an organization that doesn't get it that really started to make me mad. So this is why I'm particularly, so frustrating, so aggravating. Okay, anyway, back to my idea. So as I started thinking about family caregivers are patients, we now have codes to provide services to help these patients who are family caregivers. Why don't we have a primary care practice that specializes in family caregiving? We have pediatricians, we have geriatricians. Why don't we have primary care physicians that serve family caregivers? So that's what I'm trying to put together. That is what I'm trying to launch. A telehealth practice of primary care physicians that see family caregivers, whose patients are family caregivers. There's a couple reasons why this is important. If we have physicians who specialize in seeing family caregivers, then we see family caregivers regardless of what their age is. So if you are a young adult in a caregiving situation, you could go to a physician who gets it and start receiving additional support and services. Now, these Medicare codes obviously are part of the Medicare program, but they are also codes that a commercial payer could start to use. So even though right now, in order for individuals to receive these extra services, they have to either be a Medicare beneficiary or care for someone who's a Medicare beneficiary. We don't know what will happen in the future. And it's not a wild idea to imagine that payers would start to use these codes because supporting the family caregiver would save the system money. And if you are paying auxiliary professionals for care coordination, stress management, coping skills, planning, strategizing, you're also saving money so that clinicians can actually perform at the top of their license. We want clinicians to practice medicine. Auxiliary professionals like caregiving coaches who have a personal caregiving experience are the perfect ones to provide these other services. It frees up the clinicians to just practice medicine. We're going to actually be experts in the practice of family caregiving and supporting them. And our services are now reimbursable through Medicare. Now, just as a reminder, people always overlook this, that a Medicare recipient can be a family caregiver. I had this conversation yesterday with a colleague and she was like, wait, what? Because I was telling her about these new billing codes. And she said, well, I don't get how this works if you're a family caregiver. And if you're a family caregiver, it doesn't say anything about family caregiving and how it's written. I said, but a family caregiver can be a Medicare beneficiary. And if the social determinants of health risk assessment includes a question about caregiving, they can receive support around their experience. They can connect to an auxiliary professional who can research resources, put a plan of care together for the family caregiver. The family caregiver is a patient too. And then the other way it could work is the Medicare beneficiary, who's the caree, has an advancing disease process and can't participate in their own care planning. The family caregiver can receive those services then on behalf of the Medicare beneficiary. These new billing codes all relate to social determinants of health. So social determinants of health measure our life. How socially connected are we? How easy is it for us to get to doctor's appointments? How readily available is good, healthy food for us? So we think about blood pressure, for instance. Our social determinants of health might measure our stress level. And as family caregivers, stress is part of our life. And if we have a physician who understands that, our conversations during our own with our physician changes, because then it's about what's stressing you out, what's worrying you, what can we do to support you, what kind of resources could we help you find. It's the holistic way of taking care of a family caregiver. And again, if we start early on in a caregiving experience with a physician who understands, so connects family caregivers right away to support, we have a healthier family caregiver throughout the experience, and we have a healthier family caregiver after the experience. For instance, let's say I start to help someone in the family because that family member has received a diagnosis. It just turns out that it's time for my annual telehealth. So it's convenient, a telehealth visit with my doctor. I complete what's called a social determinants of health risk assessment. And in that risk assessment, it says, who are you worrying about? And I say, I'm worried about this family member who just recently received a diagnosis. The doctor sees that and says, okay, I want to connect you to a caregiving coach to talk about this. I want you to complete an after the diagnosis plan that helps you think through the impact of this family member's diagnosis on you. And then there's no cost to the patient because it's billed to insurance. And because I'm connecting to a caregiving coach who gets it, and I might be able to select my caregiving coach. So I'm selecting someone who I know will get it because I've read their bio, I've looked at their website, I understand their story. Then I really am going to go into the conversation trusting that this is a service that's going to understand me. And that right there is a stress relief. Okay, so primary care for family caregivers. This is a tall order. I mean, this is going to take not just one miracle, but a lot of miracles. I just want to let you know that I have been working on this steadily for a little over a year. I've been connecting with telehealth organizations, trying to connect with telehealth organizations. I've been connecting with clinics. Oh, and this morning I was like, I don't know about this. Maybe I should give it up. And I thought, well, maybe I should start talking about it more and then have some accountability by posting regular updates so I keep working at it. So that's what I'm going to do. I'm going to tell you about it. I'm going to keep working at it. If you have a doctor in the family, that'd be awesome. Oh my gosh. I believe we need physicians who specialize in supporting family caregivers. And again, family caregiving isn't about the family caregiver's age. It can happen at any time. So if we have physicians who can help family caregivers, we can keep them healthier throughout the experience and healthier after caregiving ends. And we also can start helping young adults in a caregiving situation, which we don't do well. I mean, we don't support family caregivers well anyway, but when they're young, we don't. If we have physicians who understand and connect with a young adult, we can connect that young adult to support and services that help, and then continue to provide support and services that help. We are in a unique life when our life includes a caregiving experience, and we deserve to have a primary care physician who gets that, who has a different kind of conversation with us because of that, and then can refer us to resources and support services that help. That's what we want. Timely, appropriate, relevant, affordable, accessible support that helps. And it can start with the family care, with the primary care physician who specializes in supporting family caregivers and taking care of family caregivers. Okay, I'll keep you posted. You can subscribe to our YouTube channel so you'll see updates from me, and you can join our community, caringourway.com. I'll post updates there as well. Again, this is a tall order. I'm not a doctor. I'm not a billionaire, but I'm going to try. And I'll keep you posted because I think I have a couple ideas about how we could try to raise some money in an easy way, not in a way that you think, oh man, whoa, whoa, whoa. Okay, thanks for watching. Thanks for watching. If you have any suggestions, comments, please share. And again, I'll keep you posted. Thanks for all you do. Bye-bye.